Hi there, Troy Sternberg, East Pierce Fire and Rescue. This is my final project for Pierce College, the Fire Service Leadership Management 370. Thank you for joining me today. What I'm doing is we've got a epidemic going on with our opioid usage. And what I'd like to continue to do is the distribution of home Narcan kits within our fire district. East Pierce Fire and Rescue, a little bit about them. East Pierce Fire and Rescue began with a merger in the year 2000 between the City of Bonnie Lake, Lake Tapps Fire, and Pierce County Fire District 24. With the merger of those three departments, or small departments, it allowed ALS service with medic units transporting to the hospital. So that gave us initial first response to all the citizens of our district at that time. 6 years later, Pierce County Fire District 12, which is the Prairie Ridge and the kind of the Buckley Bonnie Lake area, and then down into South Prairie, merged into, or I should say, annexed into the fire district of East Pierce. A couple years after that, in 2008, the City of Sumner, who was already doing ALS responses, merged into East Pierce, and also parts of the border of the City of Sumner was Pierce County Fire District 1. And then the last merger in 2010 and in 2011 was the City of Edgewood, or Pierce County Fire District 8, and the City of Milton Fire Department. All told, when those mergers happened, it gave us a response from 6 career staffed stations. We have 130 approximately line staff personnel, and our daily staffing is able to staff with 3 on our ladder truck. We have 5 engines staffed with 3. We have 4 medic units and then 1 battalion. Our area covers 153 square miles with a population of approximately 96,000. Our average calls per year, about 12,000 calls per year, and 72.5% of those are EMS related calls. The project that I'm dealing with is our opioid overdose epidemic that's happening not only in our country but definitely within East Pierce. Opioid is described as a class of drug that includes heroin, synthetic opioids such as fentanyl, pain relievers that are legally prescribed such as oxy or oxycodone, oxycontin, hydrocodone or Vicodin, codeine, morphine, and these can be misused, being they're prescriptive drugs. They're on a misuse around the country and definitely within East Pierce. About 20,000 people die a year with overdose on prescription drugs, and this is according to the National Institute on Drug Abuse, which is a federal agency, and the fix that we can do, and that's why the ALS service that we provide to our district, the fix for that is providing naloxone, or some people call it Narcan, just another name for it. So naloxone, given, it rapidly reverses the opioid overdose. It binds to the opioid receptors and can reverse the effects of opioids. What an opioid will do is it'll stop your breathing, and a person goes unconscious because of this overdose, and usually the stopping of the breathing is the big deal. A citizen, a family member, a friend that's able to give a dose of the Narcan and Their dose is a nasal spray that the person laying flat on their back, they use the one like in the lower right-hand corner of your PowerPoint screen, would spray that full dose up one's nose, and it can have that reversing effect. Obviously, the other two on the left, you're going to see which comes with our ALS response units. However, with a delayed response time, or I shouldn't say delayed response time, but a normal response time of anywhere between 5 and 6 minutes, and then you have your time of dispatch and the phone call. There can be a lot of time where a person is potentially not breathing, and if they're not breathing, they're not oxygenating their brain. If they're not oxygenating their brain, then bad things can happen, obviously. So the IV administration is obviously one of them. There's auto injectors that people can get prescribed by a doctor. Or in the top left is one that's a atomizing device that you can put the Narcan in, and our medics would be able to spray that up one's nose to reverse the effects of the Narcan. I'm sorry, of the opioid. The biggest thing out there is obviously prescription drugs are expensive, or a doctor stops writing that, and then now people go to the street version, like your lower left, which is the dirty version of opioid, which is heroin, and that's where you're getting the injectables, and things are being mixed in with it that are giving bad effects to our patients. So, give you a couple of statistics. Countrywide, opioid overdoses account for about 42,000 deaths in 2016, more than any previous year on record. An estimated 40% of the opioid overdose deaths came involving prescription opioids. Now compare that to 2018, nearly 70% of the 67,000 deaths involving opioid, that's 47,000 deaths involving the abuse of an opioid. So, excuse me, of the drug overdoses that we have in 2018. Statistics usually take a couple of years to catch up. Now that's countrywide, right? For East Pierce Fire and District, East Pierce Fire and Rescue, we're dispatched to hundreds of overdose calls a year. The problem is a lot of our overdose calls are lumped in together between alcohol, prescription drugs not being specifically an opioid, poisonings. This kind of skews our numbers because all those are lumped into one category of an overdose. So it's just been in the last couple of years that we've been able to revamp our program. We use electronic patient care record or electronic health care record through the ESO company. And they've got a bunch of drop-down menus, and just in the last couple of years, since about 2018, there's been a bunch of drop-downs that we've been able to specifically select the primary impression being opioid or heroin, prescription drugs, such like that. So our data just in the last 3 years is significantly better. However, this still has the generic names on there in which they're trying to get out, meaning somebody can select substance abuse. Well, substance abuse can also be alcohol. So they're making some changes, and that's part of this whole program that I'm trying to push. Is not only do we need better documentation, we need training for better documentation for our personnel, so they know exactly how to, because data is everything when it comes to pushing these to getting buy-in for these programs. However, with the limited data that we do have and the better data just in the last couple of years, we were able to say, hey, here is the statistics for that. So in 2018, we were dispatched to 55 overdose-related calls specific to opioids. So of those, Narcan was administered 12 different times, and you can see that in the graph that I put in there. And In 2018, there were 2 Narcans administered prior to EMS arrival. So in 2019, they're dispatched to 64 opioid-related incidents, so more than the previous year. And Narcan was administered 23 different times, with 7 times Narcan administered prior to our arrival. So kits that had been given out in the years past had been used. And like I said before, we have a program of a Narcan kit administration or distribution to our citizens, but it's only just been in the last couple of years that we've had that going. Get to a little bit more about that later. So in 2020 so far, right up until before Thanksgiving here, our units were dispatched out 58 times for overdose-related calls. Narcan was administered 23 different times, and only so far we only have a single dose of Narcan this year that's been administered prior to EMS arrival. So once again, the challenge is our data collection. I'm sure there are more of the Narcan administered prior to arrival, because looking back at some of the calls, we do have law enforcement there, and law enforcement in our communities do have Narcan kits. We've given them to them and done the training. So there are more Narcan kits that are being used. But what it does is it takes the provider that's doing the report to mark down that Narcan was administered prior to arrival. It's not a required field that pops up as an auto-populate that they have to select. It's just one that they're going to have to remember to document. So the reason why we're coming to this, our community resource paramedic manages the program. She was able to get a grant for the first set of Narcan nasal spray kits, and she was able to get them through a research project, the Point Defiance AIDS project, or the Dave Purchase project, through a cooperation with Northwest Integrated Health. The original kits came from a research project that was actually through the University of Washington. The kits were put in stock, and we put the kits, the 2-pack kits, on our engine, 5 engines in our ladder. Each of those rigs carries 2 kits. And if we go on an overdose call, one of those kits is given out to a family member that's at scene, especially if we've gone to, we got frequent flyer that we've gone to multiple different times. So I've actually seen the benefits of those kits work, where I've gone to a frequent flyer and the person has been coming out of the effects of the heroin in this case, and the family had given both doses of the Narcan. It's a 2-pack kit, and already the reversal effects were happening when they went from not breathing and the family members doing CPR to breathing, and actually by the time we left the call, they walked out to the rig. So the kits do work. So we went through that program, that research, and when we went to resupply our stock, there was no longer stock available. I'm hoping with the data that I've collected and that I've worked with firefighter Killian, of our community resource paramedic, that we'll be able to justify the need for those kits. If you went back to our numbers, the amount of times that Narcan was administered, and this is the Narcan administered by our folks, just think of the amount of Narcan that would have been administered prior to our arrival and had a good outcome. So what can we do? We can continue to get these Narcan kits on our rigs. We we end up giving them to family. We end up educating the family, making sure they know what to do, putting it into a safe place, and then to be used if their family member was to overdose on the drug again. Obviously, it's not a fix. We continue to encourage them to get into treatment. However, this is one way to prevent their death. So, what I'm asking for a plan. I would like the funding to continue the program. Obviously, our kits aren't getting provided to us free of cost anymore through this program. So, to get the funding, the kits cost about $200 per kit. And if we put each of those on the rig, that's just an initial cost. We still have kits in stock right now, so it wouldn't be a lot of upfront cost. It would be the continuation of the program. However, with that, we need training for our personnel on proper documentation. So we need a training, whether it be an online, video-based training, or it be hands-on, to say, these are the boxes that we need you to check, so we can continue to collect data and document the usage of these kits. We also would probably need a directive that goes out to our personnel and said, these are the steps to take when you're giving out a kit. This is the information that we need. This is the documentation that we need, so we can justify the use of these kits. So, in closing, we can make a difference here. We can stop the deaths related to our opioid problem, our heroin, and our prescription drug overdoses. We need the funding. We need the support to be able to do this, and we would really like to continue with the citizen Narcan kit distribution program that we have going on currently, and we're hoping for your support.